Taking care of an elderly parent can be a challenging but rewarding experience. It's important to plan and consider both your needs and your parents' needs for long-term care. Here are some steps to help you navigate this new responsibility. Assess their needs. Evaluate your parents' physical, emotional, and cognitive needs. Determine the level of assistance they require in their daily activities, such as bathing, dressing, mobility, medication management, and meal preparation. Medical evaluation. Consult with your parents' healthcare providers to understand their medical conditions, treatment plans, and any specific care requirements. Legal and financial planning. Ensure that your parents' legal documents are in order, such as wills, power of attorney, and healthcare proxy. Review their financial situation to determine what resources are available for long-term care and if additional support, like Medicaid, may be needed. Research care options. Depending on the level of care required, you may need to consider various options such as in-home care, adult daycare, assisted living, or nursing homes. Research and visit potential care providers to determine the best fit for your parent. Develop a care plan. Create a plan that addresses your parents' needs, preferences, and goals. This plan should include medical appointments, medication management, daily routines, and emergency contacts. Build a support network. Reach out to family, friends, and community resources to establish a support network. This can help share caregiving responsibilities and provide emotional support for both you and your parents. Self-care. Taking care of an elderly parent can be demanding, so it's essential to prioritize your own well-being. Make sure to practice self-care, such as exercise, healthy eating, and getting enough sleep. Stay organized. Keep important documents, medical information, and schedules organized and easily accessible. This can help streamline communication with healthcare providers and other members of the support network. Monitor and adapt. Regularly assess your parents' needs and the effectiveness of the care plan. Be prepared to make adjustments as their health changes or new resources become available. Seek professional guidance. Reach out to professionals like geriatric care managers, elder law attorneys, or financial planners for advice and assistance in navigating long-term care decisions. Remember that each situation is unique, and your parents' needs may change over time. Be patient, flexible, and open to adjusting your approach as needed. What is long-term care? Long-term care refers to a range of services and support systems designed to meet the ongoing needs of individuals who have difficulty performing daily activities due to chronic illness, disability, or the natural aging process. Long-term care is not limited to medical care. It also includes assistance with personal care, household chores, and other daily tasks to help individuals maintain their quality of life and independence. Long-term care can be provided in various settings, such as in-home care. Caregivers, either family members or professional home care aides, provide assistance with daily activities, personal care, and household tasks in the individual's own home. Adult daycare. Community-based programs that offer structured activities, socialization, and supervision during the day for individuals who require assistance or supervision but can still return home in the evenings. Assisted living. Residential facilities that offer a combination of housing, personal care services, and supportive services for individuals who need assistance with daily activities but do not require the intensive medical care provided by a nursing home. Nursing homes. Long-term care facilities that provide 24-hour medical care, personal care, and support services for individuals with significant health needs or disabilities. Continuing care retirement communities, CCRCs. These communities offer multiple levels of care, from independent living to nursing home care, allowing residents to transition between levels of care as their needs change over time. Long-term care may be provided by a combination of family caregivers, friends, and professional care providers. The appropriate level and type of long-term care will depend on the individual's specific needs, preferences, and financial resources. How do I find out where or if my parent is covered for it? To find out if your parent has coverage for long-term care, you will need to review their insurance policies and other financial resources. Here are some steps to help you determine their coverage. Health insurance. Check if your parent has private health insurance or is enrolled in a government-sponsored program like Medicare or Medicaid. Contact the insurance provider to understand the coverage details and any restrictions related to long-term care services. Long-term care insurance. Determine if your parent has purchased a separate long-term care insurance policy. Review the policy documents to understand the coverage, eligibility requirements, waiting periods, and benefit limits. Medicare. Medicare generally doesn't cover long-term care services like custodial care or assisted living. However, it may cover some short-term skilled nursing care or rehabilitation services following a hospital stay. Review your parents' Medicare benefits and limitations to understand what services may be covered. Medicaid. If your parent has limited income and assets, they may qualify for Medicaid, which can cover long-term care services, including nursing home care and home and community-based services. Each state has its own eligibility criteria and covered services, so check with your state's Medicaid agency for more information. Veterans benefits. If your parent is a veteran, they may be eligible for long-term care benefits through the Department of Veterans Affairs, VA. Contact the VA to inquire about eligibility and covered services. Life insurance. Some life insurance policies may have provisions for long-term care benefits, such as accelerated death benefits or long-term care riders. Review your parents' life insurance policy to see if any such benefits are available. Pension or retirement savings. Review your parents' pension, retirement accounts, and other financial resources to determine if they have sufficient funds to cover long-term care expenses. Other resources. Explore other community resources or financial assistance programs that may help cover long-term care costs, such as state-funded home care programs or services provided by local nonprofit organizations. Once you have a clear understanding of your parents' coverage and resources, you can start exploring long-term care options that align with their needs, preferences, and financial situation. You may also consider consulting with an elder law attorney, financial planner, or geriatric care manager to help navigate the complex world of long-term care financing and services. Can I still get them long-term care insurance now? It might be possible to obtain long-term care insurance for your parent, but the availability and cost will depend on several factors, including their age, health status, and pre-existing conditions. Insurance companies typically require applicants to undergo medical underwriting to assess the risk and determine eligibility for coverage. If your parent has significant health issues or is already receiving long-term care, they may be denied coverage or face prohibitively high premiums. Here are a few things to consider when exploring long-term care insurance for your parent. Age. The older your parent is, the higher the premium will be. Insurance companies typically charge higher rates for older applicants due to the increased likelihood that they will require long-term care services in the near future. Health status. Applicants with pre-existing conditions or poor health may face higher premiums or be denied coverage altogether. Some insurance companies offer simplified underwriting or guaranteed issue policies with fewer medical questions and no medical exam, but these policies typically come with higher premiums and more limited benefits. Waiting period. Long-term care insurance policies usually have a waiting or elimination period before benefits are payable. This is the number of days your parent must receive long-term care services before the policy begins to pay benefits. Choosing a longer waiting period can help lower the premium cost but may leave your parent responsible for covering care expenses during that time. Benefit period. The benefit period is the length of time the policy will pay for long-term care services. Policies may offer benefits for a specific number of years or for the lifetime of the insured. A shorter benefit period will generally result in lower premiums. Inflation protection. Long-term care costs tend to rise over time, so it's essential to consider inflation protection when purchasing a policy. Inflation protection options, such as automatic benefit increases or the ability to purchase additional coverage in the future, can help ensure that the policy's benefits keep pace with the rising cost of care. However, adding inflation protection will increase the premium cost. If you're considering long-term care insurance for your parent, it's a good idea to consult with an insurance agent or financial planner who specializes in long-term care planning. They can help you understand your options, compare policies, and determine whether long-term care insurance is a viable solution for your parent's needs and financial situation. What are some benefits of having long-term care insurance? Long-term care insurance can provide financial protection and peace of mind for individuals and their families as they face the potential need for long-term care services. Some of the benefits of having long-term care insurance include protection of assets. Long-term care insurance helps cover the cost of care, reducing the need to spend personal savings or sell assets to pay for services. This can help preserve your or your loved one's financial resources for other needs, such as living expenses or leaving an inheritance. Access to a broader range of care options. Long-term care insurance policies typically cover various services, including in-home care, assisted living, adult daycare, and nursing home care. This allows individuals to choose the most appropriate care setting based on their needs and preferences. Flexibility in care providers. Long-term care insurance policies often allow individuals to select their care providers, giving them more control over the quality and type of care they receive. Care coordination. Some long-term care insurance policies include care coordination services, where a professional care manager assists in identifying needs, developing a care plan, and arranging for appropriate services. Relief for family caregivers. Long-term care insurance can help alleviate the financial and emotional burden on family members who might otherwise have to provide care themselves or cover the cost of care out of pocket. Tax benefits. Long-term care insurance premiums may be tax-deductible, depending on your age and the policy type. Additionally, long-term care benefits received from a tax-qualified policy are generally not considered taxable income. Independence and dignity. With long-term care insurance, individuals can access the care they need without relying solely on family or friends for assistance, promoting a greater sense of autonomy and dignity. Early intervention. Long-term care insurance coverage may enable individuals to access care services earlier in the course of their illness or disability, potentially improving their health outcomes and quality of life. It's essential to consider the potential benefits of long-term care insurance in the context of your or your loved one's specific needs, preferences, and financial situation. Consulting with a financial planner or insurance agent who specializes in long-term care planning can help you evaluate the suitability of long-term care insurance and make informed decisions about your long-term care options. What exactly is not covered by long-term care insurance? While the specifics of what is not covered by long-term care insurance can vary depending on the individual policy and insurance provider, there are some common exclusions and limitations you should be aware of. 1. Pre-existing conditions. 2. Waiting or elimination period. 3. Benefit limits. 4. Non-qualified care provider. 5. Mental and nervous disorders. 6. Alcohol or drug addiction. 7. Intentionally self-inflicted injuries. 8. War-related injuries. 9. Care outside the policy's geographic area. 10. Non-medically necessary care. As an adult child responsible for a parent who is unable to care for themselves, it's important to understand long-term care insurance and how it can help protect your parents' financial resources and ensure they receive the care they need. Here is an overview of what you need to know about long-term care insurance. Purpose. Long-term care insurance is designed to cover the cost of long-term care services for individuals who need assistance with daily activities, such as bathing, dressing, eating, and mobility, due to chronic illness, disability, or age-related decline. This type of insurance can help preserve your parents' financial assets and provide them access to a range of care options. Types of care covered. Long-term care insurance typically covers various care settings, including in-home care, adult daycare, assisted living facilities, nursing homes, and sometimes continuing care retirement communities, CCRCs. The specific coverage depends on the policy's terms and conditions. Eligibility for benefits. Most long-term care insurance policies use a benefit trigger to determine when your parent is eligible to receive benefits. Common benefit triggers include needing assistance with a certain number of activities of daily living, ADLs, or having a cognitive impairment, such as Alzheimer's disease or dementia. Waiting or elimination period. Long-term care insurance policies often have a waiting or elimination period, which is the number of days your parent must receive long-term care services before the policy begins to pay benefits. The waiting period can range from 30 to 180 days, depending on the policy. Benefit period. The benefit period is the length of time the policy will pay for long-term care services. This can range from a specific number of years, e.g., 3 or 5 years, to the lifetime of the insured. Daily or monthly benefit. Long-term care insurance policies typically have a daily or monthly benefit amount, which is the maximum amount the policy will pay per day or month for covered long-term care services. Inflation protection. To ensure the policy's benefits keep pace with the rising cost of care, consider adding inflation protection options, such as automatic benefit increases or the ability to purchase additional coverage in the future. Premiums. The cost of long-term care insurance depends on various factors, including your parents' age, health status, benefit period, waiting period, and benefit amounts. Premiums can be expensive, especially for older adults, so it's important to carefully evaluate the cost and potential benefits. If you are considering long-term care insurance for your parent, consult with a financial planner or insurance agent who specializes in long-term care planning. They can help you understand your options, compare policies, and determine whether long-term care insurance is a viable solution for your parents' needs and financial situation. Keep in mind that if your parent is already in poor health or receiving long-term care, they may not qualify for a new long-term care insurance policy. What are common mistakes newbies typically make? I will provide common mistakes people make when purchasing long-term care insurance. Waiting too long to purchase. Waiting to buy a long-term care insurance until you are older or already need care can result in higher premiums or being denied coverage due to health issues. Overlooking policy details. Failing to carefully review and understand the policy's terms, conditions, exclusions, and limitations can lead to unexpected out-of-pocket costs or inadequate coverage. Choosing inadequate coverage. Selecting a policy with low daily or monthly benefits, a short benefit period, or no inflation protection can result in insufficient coverage as the cost of care increases over time. Focusing solely on cost. Choosing the cheapest policy without considering the quality of coverage, the insurer's financial stability, or customer service can lead to potential difficulties when filing claims or seeking assistance. Not comparing policies. Failing to compare multiple policies and insurance providers can result in missing out on better coverage options or more favorable premium rates.